Think about this for a second. What if your own body could kill your cancer? Not some strong drug, not surgery, not radiation. Your own immune system, retrained and turned loose. That is immunotherapy, and it is changing everything about how we treat cancer. Things that seemed impossible 20 years ago are happening right now. In this video, we will walk you through immunotherapy, what it is, how it works, which cancers it treats, what happens if you get it, and why doctors believe it might be the best chance yet for long-term remission, even cure for cancers that used to have no hope. Welcome to HealthSphere MD. Let us get started. So, what exactly is immunotherapy? Here it is in simple words. It is a cancer treatment that helps your own immune system find and kill cancer cells. Normally, your immune system is great at spotting bad things. Viruses, bacteria, cells that look wrong. But cancer is tricky. Cancer cells can hide. They can send out signals that tell your immune cells to back off. Or they just grow so fast that your body cannot keep up. Immunotherapy tears down those hiding places. It gives your immune system the tools it needs to see the cancer clearly, and then attack it. Chemotherapy kills everything that grows fast. Good cells and bad cells. Immunotherapy is much more precise. It works with your body, not against it. There are a few different types of immunotherapy. They work in different ways. We will talk about the main ones in a minute. To understand immunotherapy, you first need to know a little about how your immune system normally works. Your immune system has billions of special cells. T cells, B cells, natural killer cells. They move through your body all the time, looking for anything that does not belong. When a normal cell turns into a cancer cell, it often shows strange proteins on its surface. We call these tumor antigens. In a perfect world, your immune system would see those proteins, flag the cell as dangerous, and destroy it. And sometimes, that is exactly what happens. In fact, your immune system probably kills millions of cells that could become cancer over your whole life. You never even know it is happening. But cancer cells are smart. They learn how to hide. Some of them make special proteins called checkpoint molecules. Think of them as do not eat me signs. They tell your T cells to stand down and walk away. Immunotherapy fixes this. It blocks those do not eat me signals. It boosts your immune response, or it trains your immune cells to recognize and target specific cancer proteins very precisely. There are four main types of immunotherapy used for cancer today. Type 1, checkpoint inhibitors. These are drugs that block the off switch that cancer uses to hide from your immune system. Take that break off, and your T cells are free to see and attack the tumor. Doctors now use checkpoint inhibitors for more than a dozen types of cancer. Melanoma, lung cancer, bladder cancer, and others. Pembrolizumab and nivolumab are checkpoint inhibitors. Type 2, CAR T-cell therapy. This is one of the most exciting and advanced treatments. Doctors take T cells from your own blood. They genetically change those cells in a lab so they can find your specific cancer. Then they put them back into your body as a living drug. CAR T has produced amazing results in certain blood cancers, some leukemias and lymphomas. Type 3, cancer vaccines. Regular vaccines prevent infections. Cancer vaccines are different. They train your immune system to attack cancer cells that are already there. Some are personalized, made using material from your own tumor. Type 4, monoclonal antibodies. These are lab-made proteins that act like your body's natural antibodies. They can target cancer cells directly, mark them for destruction, or carry toxic drugs straight to the tumor. Each type has its own strengths. Doctors often mix them with other treatments to get the best result. Immunotherapy is now approved for a growing list of cancers, and many more are being tested. Melanoma, skin cancer, was one of the first big success stories. Before checkpoint inhibitors, less than 10 out of 100 people with advanced melanoma lived 5 years. Today, about 50 out of 100 treated with immunotherapy reach 5 years. This change started with a drug called ipilimumab. The MDX0010 trial was the first study to show that immunotherapy could help people with metastatic melanoma live longer. That trial opened the door to everything that came after. Lung cancer, especially non-small cell lung cancer, has also seen big improvements. Immunotherapy is now a standard first treatment for many eligible patients. Blood cancers, certain leukemias, lymphomas, and multiple myeloma, have been transformed by CAR T therapy. Doctors also use immunotherapy for bladder cancer, kidney cancer, head and neck cancers, cervical cancer, colorectal cancer with certain genetic markers, and liver cancer. Research is still going on for many more: breast cancer, ovarian cancer, pancreatic cancer. The field is growing every year. New approvals mean more patients can get these treatments. Now let us talk about results. The numbers are genuinely amazing. For advanced melanoma, 5-year survival has gone from under 10% to around 50% or more with combination immunotherapy. For some types of lung cancer, immunotherapy has doubled average survival compared to chemotherapy alone. The KEYNOTE-024 trial showed that Pembrolizumab as a first treatment for certain lung cancer patients gave them much more time before their cancer grew again and helped them live longer compared to chemotherapy. That study changed treatment guidelines around the world. For diffuse large B-cell lymphoma, a type of blood cancer, CAR-T therapy has put patients into complete remission even after they had relapsed many times on chemotherapy. And here's the most remarkable thing. A small number of patients are getting what doctors call durable complete response. That means their cancer disappears completely and never comes back. With older treatments for these cancers, that almost never happened. I need to be honest with you, immunotherapy does not work for everyone. How well it works depends on the cancer type, your genetic markers, and other personal factors. But for many patients, it is a real leap forward, and the progress is getting faster. Like all cancer treatments, immunotherapy can cause side effects. But because it works by boosting your immune system, the side effects are different from chemotherapy. Sometimes they affect organs that chemotherapy never touches. Common side effects include feeling very tired, skin rash or itching, diarrhea, joint pain, and flu-like symptoms. More serious side effects are less common. We call them immune-related adverse events, RAEs for short. These happen when your overactive immune system starts attacking your own healthy tissues. It can affect your lungs, your liver, your colon, or your hormone glands. Serious RAEs need quick medical attention. Doctors usually treat them with steroids. Patients ask me, "Doc, is immunotherapy safer than chemotherapy?" Here's what I tell them. It is not simply safer. It is different. And that difference matters, because the side effects that catch people off guard are the ones they do not expect. In my clinic, here is what I actually see. Most patients on checkpoint inhibitors handle treatment much better than they thought they would. They do not get the bad chemotherapy side effects: severe nausea, hair loss, very low blood counts. For many people, their quality of life during treatment is genuinely better than they feared. But here's what I always make sure patients understand before we start. Immune-related adverse events can affect almost any organ in your body. I have treated patients with lung inflammation from immunotherapy, colon inflammation, thyroid problems, even heart inflammation. These are not common, but they can be serious, and here's the tricky part. They can show up weeks or even months after a dose. A patient might go to the emergency room struggling to breathe or with terrible diarrhea and not realize it is connected to treatment they had a month ago. So here's my message to every patient on immunotherapy and to anyone caring for someone on treatment. Any new symptom anywhere in your body that starts during or after immunotherapy, you need to tell your oncology team the same day. Not tomorrow, not at your next appointment, the same day. If we catch immune-related adverse events early, we can manage them. If we catch them late, they can become life-threatening. One more thing about expectations. Immunotherapy sometimes works slowly. Some patients see their tumors look bigger on scans before they start to shrink. That is called pseudoprogression. What is actually happening is immune cells are flooding into the tumor before it responds. If your oncologist tells you to keep going with treatment even though a scan looks bad, there's often a good biological reason for that. Trust the process, trust your team. The good news is that most patients tolerate immunotherapy much better than chemotherapy. Many people continue working, traveling, and living their normal lives during treatment. But remember, always report side effects to your oncology team right away. Acting early makes a real difference. Your care team will watch you closely through treatment. Never stop or change your dose without a doctor telling you to. Immunotherapy is moving faster than almost any other area of cancer treatment. Here's what is coming. Personalized neoantigen vaccines. Scientists are now making vaccines specifically from the unique mutations in each patient's tumor. These are custom treatments, made for one person for one cancer. In 2023, a major trial published in the Nature by Rojas and colleagues showed that a personalized mRNA neoantigen vaccine plus Pembrolizumab helped pancreatic cancer patients stay cancer-free longer after surgery than Pembrolizumab alone. Pancreatic cancer is one of the hardest to treat. This was real proof that personalized cancer vaccines can work, even in cancers that have never responded well to immunotherapy before. Combination strategies, researchers are mixing immunotherapy with targeted therapy, chemotherapy, and radiation in new ways. Each combination is designed to wake up the immune system more effectively and overcome resistance. Earlier use, immunotherapy is moving earlier in the treatment path, not just for late-stage or relapsed cancers anymore. Now for earlier stages, even after surgery to stop the cancer from coming back. Targeting the tumor microenvironment, tumors create a shield around themselves that suppresses the immune system. New drugs are designed to break through that shield, to neutralize the cancer's home advantage. Bispecific antibodies and next-generation CAR-T. These aim to be more precise, less toxic, and work for more types of cancer. The direction is clear. Immunotherapy is not a niche treatment anymore. It is becoming a main pillar of cancer medicine. Immunotherapy is one of the most hopeful developments in the whole history of cancer treatment. If you or someone you love has been diagnosed with cancer or is having treatment right now, ask your oncologist specifically whether immunotherapy might work for your cancer type. The answer may have changed since the last time you asked. This field moves fast. If you're just learning and staying informed, that is one of the most powerful things you can do. Early detection, good conversations with your doctor, knowing your options. All of that makes a real difference. And as always, check in with your GP. Stay up to date with screening programs. And if something does not feel right, get it checked. Thank you for watching HealthSphere MD. If this video helped you, please like it, subscribe, and share it with someone who might need it. We will see you in the next one.